Next from Springfield, we talked to Tony Paulauski, Executive Director of the ARC of Illinois, an advocacy group for the developmentally disabled, and talk about the different forms of funding and programs available for the developmentally disabled and how the state budget crisis is negatively impacting their advocacy work. This runs about 10 minutes.
Tony Paulauski, thanks for joining us again on the Illinois Channel. We're here in Springfield. You're having a conference, Speak Up, Speak Out, and for those who don't know, you work with the ARC of Illinois, you lead the ARC of Illinois. Let's just tell them right off the top, what is ARC of Illinois?
Well, the ARC is the major public policy organization. We write most of the disability legislation here in Illinois, and we're heavily involved with making sure that people are supported in their home communities close to family and friends.
And the last time we visited, one of the key issues was having those with developmental disabilities taken out of state institutions and put them in group homes. Where does the state stand now on that process?
Well, the new administration has yet to announce any closures of state institutions, much to our chagrin. We've strongly advocated with the Rauner administration and past administrations about the importance of rebalancing the system here in Illinois. Illinois funds way too many state institutions. We spend about $300 million, almost $250,000 per person per year in state institutions.
And how many state institutions remain open at this point?
We have seven fully operational state institutions in Illinois.
And on a cost comparison, what does it cost to have somebody in a group home?
Well, I've already stated that in a state institution we're talking about $258,000 per person. That same individual can be funded in a community setting at about $60,000 per year. There's a dramatic difference, as you can see.
And in the group home, you typically have, what, somewhere like 8 to 9 or somewhere in that area of people, maybe a little less?
The ideal situation would be 4 people or less. However, because of Illinois' economic situation, we're seeing 6, 7, and 8 people in group homes, and we're not pleased with that.
Now, some critics who speak against the group homes, or what they would say is maybe the group home works fine for some, but when we talk about developmental disabilities, there are gradations, and that some people are totally fine to be in a group home. Some might even be able to live on their own in an apartment, but you also have some who are severely developmentally disabled, maybe only have the IQ of a 1-year-old, and they would argue that we need to still have some institutions for those people who just wouldn't fit into the group home environment. Is that a fair criticism or a fair observation? Well,
at the ARC of Illinois, we believe everybody, regardless of the severity of their disability, the label that they carry, can be supported in the community. The key is having the proper supports there, the medical team, the nursing if the people need the nursing. But nobody can argue the need for 7 fully operational state institutions. So, we would be happy. We've said maybe we should have 1 state institution in Illinois. That would be our compromise.
Now, as we stand here, the first day of November, the state has funded its operations through the end of the year. And when they didn't have a budget passed, all the nonprofits, you included, were just struggling to make ends meet. What are you telling those who will listen in state government about your situation, the people that you serve? What's going to happen if we go back to another financial tug of war between the governor and the speaker, and we don't have any funding bill passed once we get into January and the subsequent months?
Well, Terry, you and I have been around long enough. We know that Illinois is governed not by the state capitol. It's governed by the courts. And in our area, there's a consent decree. So our people are being supported through a consent decree right now. Those organizations, however, those programs that don't qualify for federal reimbursement, however, have closed down in Illinois because of our budget situation. So the good news is we have consent decrees in Illinois. The bad news is it only covers about 95% of the developmental disability system, so we've seen some of the system erode.
Now, one of the other issues I understand is that when we have people living in these group homes, and I've heard from parents over the years in covering this issue that they're they find their child is happier in that environment often. But you're facing a problem as far as getting quality people. You have to have people who are working there in those homes to care for the developmentally disabled and kind of manage them. What is the funding issue there as far as the people that would be working with the developmentally disabled in a group home?
I've been the executive director here at the ARC of Illinois for 25 years, and in my 25 years, I've never seen more of a challenge in terms of recruiting and retaining direct support professionals in this field. There being an average wage in Illinois right now is $9.35. So we see that people who are tenured, who've been around for a while, they're leaving for better paying jobs. And folks aren't even putting in resumes, for a $9.35. So we're in a crisis right now. What we've done is we've introduced legislation to increase the starting wage for those important physicians to $15 an hour. That legislation passed both the House and the Senate this spring. Unfortunately, Governor Rauner did veto it, so we're working on an override, and we're confident in the first week of the override session that we're going to have a victory and override that veto.
When someone gets this job, is that a salary position? Is it hourly? I mean, how much would they actually, if it's $9 an hour but they get overtime, then they're going to be making more than the $18,000 or $19,000 a year? How is that structured to pay?
Well, first of all, $9.35 an hour is poverty level. Most of our people are eligible for food stamps. What happens is that would then immediately increase the wage to $15 an hour, and then folks that are in supervisory position, nurses, caseworkers, their salaries would also go up commensurately as well.
And what I was trying to get at is how much, I guess, would it end up costing the state? How many people approximately are employed, and trying to multiply this $6 an hour increase over how many different people?
Yeah, 34,000 people. The state has put a fiscal note on that of $313 million. Half of that is reimbursed by the federal government.
Okay, so about $150 million or so that would come out of additional state.
Yeah.
Is there any additional funding mechanism in there, or is it to come out of general revenue funds?
No, it's matched 50% by the federal government. But an interesting note here.
I mean, on that $150 million, how would that be funded?
That would be general revenue. Yes, general revenue.
And I'm sorry, you were going to say about a fiscal note.
And that's the fiscal note. But the other part of this is I mentioned that we're being run by consent decrees here. The court monitor has found the state to be non-compliant in the area of quality of care, because what's happening with the turnover of direct care staff and the quality of services and the stability of the workforce is affecting the quality of taking care of people in their homes and in employment and things like that. So we have a court monitor, a federal court monitor, finding the state in noncompliance. Something's going to have to give here.
And of course, as we just went over the numbers earlier, you're arguing that for every patient that you move into a group home, the state is going to be saving in the neighborhood of about $200,000 a year.
Oh, absolutely. Yeah, absolutely. There's tremendous savings. So that is one way, you could fund that. And let's be realistic. Someday we're going to get a budget here in Illinois. There's going to be new revenue on the table, and that's also where we need to go as well.
Lastly, as we're here and you have the Speak Up, Speak Out, what are the issues? Are there any other issues that you want people to be aware of as far as that you're pounding the table?
Well, the Speak Up, Speak Out Summit is an incredible advocacy event. There's 530 individuals with intellectual and other developmental disabilities here talking about what's important to them. And you know what they want, Terry? Same thing there. They want a job. They want a nice place to live. They want to be able to recreate in their communities and be close to family and friends. It's a great event.
We were talking off camera, and I was saying, and I've observed in a previous year, and it's always stuck with me, that when you talk about developmentally disabled, and people would use the old term back in the 50s and the 60s that they were retarded, which we don't use anymore. But the fact is, I was shocked at how some of these kids were getting up and asking policy questions of the director when they were here, and it was just amazing. And some were saying, I don't want to be in a group home. I want to live out on my own in my own apartment. I mean, how independent some of them are, and how, I mean, they were probably asking more insightful questions than the average Joe on the street would ask.
Well, Terry, think about this. If you have a loved one or you are a person with a developmental intellectual disability, public policy rules your life. It determines the quality of your education. It determines the quality of your health care. For the folks that are here at the summit, has to do with where they live. So they're very much impacted, and they need to have their voice heard. They're the most important voice in this field.
Yeah, and lastly, when we talk about state government and what care it provides to different groups, obviously the developmentally disabled are, I think most people would say, are a group that we're not going to say, well, they should just take care of themselves. I mean, that they're going to need a helping hand from the rest of society.
Yeah, the developmental disability is not going to go away. But what we know in my career, Terry, is the more that the more stable a staff that we have, and the more attention we pay to the individual's wants and needs. My gosh, I'm seeing people with Down syndrome now that are starring in television shows. It's remarkable the progress that we've made.
In fact, I just saw someone, they're using one of the big national changes, using someone with Down syndrome as a model, just so that we're not, as a society, kind of pushing them off out of sight, out of mind, to kind of say they should be part of, the fabric of America.
Tune in and see Born This Way. It's one of these living situations that's being filmed, and it's about the lives of 7 individuals with Down syndrome and how they live their lives and their families. It's a remarkable program, Born This Way.
Well, Tony Paulauski, we'll follow what happens in the veto session, and good luck, and thank you again for joining us.
Thank you, Terry.
Thanks.